start this panel, we want to start with a very basic question. That is, how are women who are seeking medical attention treated differently, and how are they inherently facing gender biases? Doctors, your opinion?
Yeah, if Devayani is probably muted, she's trying to say something.
No, I was saying,
Yeah.
go ahead. Why don't you start off on that one?
Okay. Hi, everybody. Thanks for joining in. So yes, Saba, very, very important. Women historically have been treated different practically everywhere. And very unfortunately, it's the same in healthcare. We are being able to change it bit by bit by increasing awareness about this, but we still have a long way to go. I think the most basic thing that I could start with is, when women complain of pain, even till this day, if I were to talk about certain specialties, gynecological procedures, pap smears, there's a lot of what should I say? People are very hesitant, first of all, and those who do come forward, they are not really probably explained everything properly, and if they were to face any discomfort, which many women do, we don't really have any pain management for that procedure during the procedure. Afterwards, maybe someone might prescribe either a local anesthetic jelly or systemic analgesics or anything like that, but I think we really lack an understanding of what pain really does and how to manage that pain, or even as a reassurance for whether or not you would require some form of pain management, or what is your threshold like. The word hysteria is very, very frequently used for women who complain of pain. They are just seen as nagging people, and it's really unfortunate. Dr. Devayani, how have you seen this in your practice?
Yeah, absolutely. I completely agree with what you said. And I think the problem, even today, even in 2022, I think it starts at home. And it starts with the fact that, think of us, okay, or think of our mothers closer to home. And if you think that they have, say, a pain or some kind of symptom, which is there, but they're kind of dealing with it on a day-to-day basis, they'd rather deal with it, go on with the rest of their work, not let it be an inconvenience to anybody. And by the time they actually go to the doctor, it's something that they really aren't being able to tolerate. So tolerate being the key word here. I mean, I think women in our society, and I'm not just talking about Indian society, I think it's, the world as one big society, unfortunately, in this case, that women are just expected to tolerate their symptoms for as long as possible. And when they finally do go to a healthcare professional, I think there's also, like Dipshikha said, a lot of bias as to how their symptoms are perceived. And each one of them has to legitimize their symptoms and, actually get attention to what they're going through, which I honestly don't think a man faces.
A man, in fact, I mean, because you have a background in, I think, cancer, and I have seen patients, and we do have an oncology HTU currently running at the moment. Men coming in with a chronic pain are taken way more seriously in terms of giving them immediate pain management than women. For
Absolutely.
women, I mean, women have to say it a few times to be taken seriously, for somebody to come and actually give them something stronger than they are on currently.
And what you're saying
that's something I've
actually
seen.
Absolutely backed with a lot of evidence. So because of this talk, thanks. I mean, actually, thank you for inviting me on this, because it made me actually go online and look through things that we always thought was there, but we weren't sure whether there was data for it. But it's overwhelming. So, I mean, to put numbers to this, a woman with, say, like heart disease actually was something I was reading, and which is really surprising, that a woman who has an angina or a heart attack is almost twice as likely to get delayed treatment, because her symptoms just aren't taken seriously enough, and they don't, the healthcare professional does not escalate it to an ECG or further investigations early enough, which is shocking actually. I don't think such a thing should even be happening. And even things like diabetes is detected almost 4 years later in women than it is in males. As what kind of a world are we living in? And this is world data. I mean, we're not talking about the so-called third world, developing, branded nations. It's everywhere.
Yeah. Back to you, Saba, if you have anything of your experience to add.
Yeah, actually, why don't you tell us, Sabha? I mean, do you face that? I mean, we're talking about ourselves as healthcare professionals and we see a bias. Does that happen to you as well? Have you or ever experienced it with you or your near and dears, and you feel that you need to be a lot more assertive as to what you're going through?
I think you're on mute. Is there a problem with it? Okay, should we carry on?
Yeah, no,
Okay,
because
great.
I
You're
was,
back.
I wasn't able to unmute myself.
Mhm.
Yeah, I think this is definitely a very big concern. A lot of women, I've noticed that, whenever you go to a doctor and try to say that, I have period cramps or period pains, the way they keep telling you have a dolo and it's fine, like you're overreacting. I had a friend who actually jumped from doctor to doctor to doctor to finally realize that she actually had, like, before they actually said that, okay, you can go for an ultrasound, and then realize that she has cysts on her ovaries. So I think this pain perception is definitely something that as patients we perceive quite a bit, especially like even with gynecologists who know that, there are so many ways that your period cramps could be bad for you. So that's definitely something that patients feel all the time, I think.
Dipshikha, actually, I have a question for you here. Since you work in intensive care, so we see it a lot in cancer, and I was wondering if it's the same with you. Do you see a lot of abandonment issues? Like you have women who are possibly taking longer to recover. A lot of the family's finances are being drained because of her particular condition. And do you see a lot of women being left behind because they just don't want to invest in her anymore?
Yeah, absolutely. It happens way more than in men. Mostly, probably elderly or people with chronic diseases. But of course, I mean, me being in a tertiary hospital, it is really expensive. So I mean, it would be different. If it would, this picture would probably be different in a government setup where you don't have to pay as much. We are still, we will have to probably think about the demography. Most people who come to the
Sure.
emergency, once you get an estimate, I think a man, if I were to consider people who don't have a solid economic background or an insurance to back them, they would think twice about investing the same amount for a woman, because the man is a supposed breadwinner of the family. Again, another thing that comes in. So it's, or maybe even if they do admit the woman or the elderly lady, suppose, um, de-escalating the care is much faster in women. That's also another thing that
Absolutely.
is very, very
Absolutely.
evident.
And you'd be surprised. I mean, we're speaking about that. I mean, I come from a completely government hospital background, and even there, where they're paying barely anything, and it's still a lot that you see that they're like, okay, we just don't want to go ahead with this anymore, or we're done with the treatment, which is slightly shocking because they aren't really paying that much. But having said that, I think the government's done a pretty good job in recognizing this, and we have a lot of schemes in the government hospitals where the
Right.
women and children are
Right.
actually treated for free. So hopefully that will prevent any more of these things from happening. I hope so. But I don't think we should have been there in the first place, though.
Exactly. Can you imagine being treated different just because your gender is not the perceived common gender?
So I'll tell you what, don't you think that all of us women have kind of been exposed to that a little bit since the day we were born? And maybe, it's kind of ingrained into the way we think too. I mean, even though all of us here think of ourselves as free women who are absolutely unhesitating in what they want to do or what they want from life, but still, if you actually put in an equal stage, we still feel a little bit alarmed because you're like, hey, I'm not used to this. I'm not used to this kind of voice or this kind of freedom of expression.
Yeah, absolutely. I think social conditioning plays a huge role. It's going to take a while to break, because this has been happening over and over again. And the people who actually train us with the best intentions, they have also been exposed to an environment like this, probably even more severe than what we are facing now. So
Absolutely.
yeah, coming from that to now, it's going to be an dismantling systematic abuse or systematic mistreatment is not going to happen overnight. And I mean, still we still have a long way to go, and I think we need way more allies who realize that they are benefiting from the mistreatment of women or minorities in any capacity. So yeah, it's difficult. Even during medical training, do you remember? I remember I had a orthopedics professor. I used to be really fond of ortho, right? So there was this one time we were inside an OT and I was really fascinated. I was like, oh, can I close, or can I screw, and can I put the screws in? So he was saying, what's the point? You're going to take pediatrics or gynae, or or like a very chilled out subject like opthal or radio. So why do you want to get your hands dirty, or why do you want to work too much? It's okay, you can sit back, relax. So this kind of a patronizing thing, I guess, for anybody who shows interest, even for mentors to do something like this to women who have the same aspirations as their male counterparts, very 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 pronounced in medical school, I guess. I mean, we usually take all of these for granted. The guys, do you remember in the when, and you're actually a surgeon, so in an OT, would the scrub nurse give you scrubs as easily she would give to the boys? I don't think so.
So that's one thing, but I remember a funny story actually now that we brought this up. So we were, it's during our internship in MBBS, and I was always interested in surgery, the blood, the gore, the typical kicks, so-called, of surgery. And we go into OR, and there are three of us, all right? So there are two guy interns, and then there's me, and it's typical 3 a.m. and some emergency exploratory lab coming in, and all of us want to scrub in, and we're very enthusiastic. And the senior surgeon's like, all right. And he asked me, it's 3 o'clock, you haven't eaten or slept. Are you sure you're not going to faint in the OR? And I'm like, okay, why is this question directed at me? Any human being up at 3 a.m. without eating could possibly faint, but I think the question should be equally directed to all three. And trust me, comedy of errors. And that night, the surgery went on for a while, and the rest of the two guys I was with actually fell down to the floor. And I'm standing there wondering, like, what the hell's going on? But yeah, the patronizing attitude has been there, and as recently as we trained. But I hope it's changing now with more number of girls coming in.
Yeah, I mean, it should, ideally. More number of girls coming in would also mean that hospitals would be full of more number of doctors. So people at some point, patients, their family members, and even hospital staff, at some point they will have to acknowledge the presence of these women in medicine, and not just as sisters. They, usually I still get
So
called
have you
sister
gotten
or
that? Yeah,
didi.
exactly. I was going to ask
Yeah,
you that. I'm like,
in the
do you get
morning I
called
was just,
sister often
yeah,
enough?
yeah, every single day that I go into work, there is at least one person who is ill informed about this, will just assume, in spite of me in a different colored scrubs, to the nurses, and doing different things, asking different questions, offering a different skill set, if I may. I will still be clubbed together with traditionally perceived stereotypical roles for
So
women.
I'll give you an interesting take in this, and to say, like, the nurses are absolutely kick-ass. I think they do a better job than we do most times,
Absolutely. We
but
wouldn't be able to do what we do
we
if
wouldn't be
we did not have
if
nurses.
it
No.
wasn't. Absolutely. So, there were so I've kind of chilled out a little bit about this now, because I'm like, this is too big a battle to fight, and I'm just going to get my head in a tizzy for nothing. But I used to be very vocal about it. And I remember one of the early days, they say sister, and you tell them that, nahi, my sister nahi hu. And they go like, oh, we didn't mean it in that way. We just didn't know what to address you. And sisters just like, like actual
Yeah.
behen wali sister. And I'm like, yeah, I'm
As
not that
as
either, right?
respect.
Exactly. And it's really funny now, because the institute that I work in Tata, so we have almost 40% of the surgeons who are women, okay, and 40% is a huge
Wow.
number.
Nice.
And at the
Yeah.
same time, when I think of the nursing staff, 40% of the nursing staff are actually male.
Mm.
So even though the numbers here are well balanced,
Mm.
I don't see a doctor being called brother often enough.
Yeah, I don't think I've seen that ever. In fact,
I
I
haven't seen that
remember
ever either.
I remember when I was an intern in, I think I had an emergency posting back then. I received a patient with a really bad crush injury of the hand, and I was, trying to, get it dressed in of some sort. I mean, so that we could just get an X-ray or something like that. And I remember I had a male nurse next to me, and the patient would I'm volunteering information. I'm explaining everything that I'm doing, everything that's going to happen next, what the plan is, if we are not able to salvage the limb, what we do next. I'm explaining everything. And so what this patient, after getting all of this information from me, looks to the male nurse and says, doctor, is everything okay? Is everything she's saying going to happen? And I mean, he was obviously very, very uncomfortable, and he was like, no, I'm not the doctor, she's the doctor. And so confused patient, confused family, itni choti hai, aurat hai, doctor hai. Oh, so matlab, it's it'll take a while, I think, um to even for men to even for people to realize that men are never confused in this way. In fact, I was actually having this doctors being referred to as sisters conversation with a few male doctors in my own department a few months ago. They couldn't understand what I was talking about. They actually thought that the relatives were referring to me as their sisters, younger sisters or something, not nurses. So it took me a while to explain that no, he does not even think that I can be a doctor. I'm at best a nurse, or like a nutritionist, or some allied services, but not a doctor. So yeah, hence the hashtag. I think we need hashtags like this is what a doctor looks like, or this is what a surgeon looks like. So,
Yeah.
Absolutely. But
but that's
silver
very
lining to
limited to
this,
theater, I guess.
yeah, it is changing a little bit, I think,
Yeah.
because the patients that we see now, I mean, at least 4 years or 5 years post training, I think it's kind of getting a little bit better, and
Mm, yeah.
people seeing more women in leadership roles as far as healthcare goes. So let's hope the trend continues. And Sabha, I think both of us kind of found
I've
common ground
taken
in this
over. Yeah.
and bonded.
Yeah, yeah,
Exactly. So we'll
Please
just
definitely.
go to
point
the
us in the
next
next.
But
question.
but as a just a follow-up question, as a patient though, what do you think? Because a lot of doctors, like we said about pain perception, a lot of doctors tend to label it as hysteria, or like women are conditioned to believe that you are a hypochondriac, you're just overreacting. So in that sense, is there any advice you would give to patients when they feel like they are uncomfortable with something, there is some amount of pain, but no one is taking them seriously? Is there a pain scale or something that, just believing that if you're uncomfortable enough, is it worth getting medical attention, even if others are telling you it's not a big deal?
This is a really good question. If I may take it, Divyani,
Of
I
course,
think
please go ahead.
it's important for any person to feel comfortable first and foremost. If you are not being heard, that's not the right doctor for you. Your doctor has
Hmm.
to listen to what you are saying, has to rule it out as a physical pain first before saying that you're a hypochondriac, you're overreacting. Very, very common things that women and maybe even a few men here, if you're dealing with chronic pain or something like that, something that is perceived to be painless. Of course, pain tolerance is something that we have to take into account. There is a visual pain score for us to know how uncomfortable is too uncomfortable for somebody. So
Hmm.
yeah, I mean, I think the first step would be to please change your doc. Don't lose faith in the medical system. We're really sorry that it's like this, but we are trying to be better. And find a doctor, find somebody who will listen to you, find somebody in the hospital who can redirect you to somebody who actually would make you feel seen and heard. So, yeah, Dr. Devyani, what do you think?
Yeah, and as to what, as a patient, all of us could probably do differently is be very, very unashamed in stating what you're going through. So I think the days are gone where we need to be hesitant and unsure and intimidated by our surroundings. So it's easier said than done, because like we discussed, it's years of mental conditioning in a particular
Yeah.
direction. But I think until we own ourselves and take ourselves that seriously and think of ourselves as that important, that's the only way we're going to get it across to somebody across the table. And
Mhm.
that self-assertion probably needs to be the first step for all of us, you and me alike. I don't think even we are going to be any different if we have an experience going to a healthcare professional. We'll always try to play down, kind of, you know, make excuses for what we are feeling, which we really don't need to do.
Yeah,
Yeah, definitely.
absolutely.
Could you tell us a little bit more about how women are disadvantaged by the way medical research is, structured and funded?
Would you like to take
Go
it?
ahead, Dipshikha, take that one. Yeah.
Okay, I'm sorry about my dog, but yeah, I think every we have these gatekeeping things that keep women out. First of all, I think the pandemic has probably, I mean, before I come to medical research, the pandemic was a huge thing that, people just assumed that women would fall into caregiving roles and nothing else would suffer. I mean, of course, their work suffered. It's the fact that I get to do this uninterrupted by kids. I mean, supposing I had kids, it would be a task for a woman sitting at home to go into a meeting like this and not be interrupted without having to negotiate with the partner. Okay, you please take care of the kids and everything. So even that plays a role into what you feel comfortable in doing and what you feel comfortable undertaking in terms of a career in research. So it's very important to note that the entry into research is very, very restrictive for women. And once you are in, if you see the statistics, men are significantly higher paid. They are able to secure much more funds for their studies. They are able to secure much better positions by virtue of them just being men and being seen as, a person who is probably more responsible, or a person who will have less, comparatively less distractions than women. So all of these things are, I think, huge things that play a role in women not having as much of a representation in research. In Dr. Devyani, you could. I mean, I was just going on a different direction, I guess. If you would
No,
like
so
to.
interesting you say that actually, and thinking about the pandemic again, we actually did a study from the Tata Memorial where we got in surgeons, because we're all surgeons here, and we got almost 1,000 surgeons, 1,800 surgeons to on a survey, in the pandemic, as to who's taking care of the cause. Are they equally distributed between the male partner and the female partner, the kids' homework, online schools? And the responses were staggering. So it was almost like 80% and 60%. So the difference was amazing, that the women were expected to give up on their whatever online work responsibilities or whatever hospital duties they had during the peak pandemic time. And it was a default thing, a de facto thing, that they had to take care of whatever was happening at home, and not like an equal distribution between genders. And when we explore that a little bit further, so Dipshikha, I think you'll agree with me that the concept of protected time for research anyway does not exist in India. So you are trying to get your papers published and your voice in terms of science heard on your own time. I mean, you're seeing patients back to back in your clinical hours, and then you come back home, and the time that you're actually supposed to spend with your family or spend with yourself, for that matter of fact, you're like trying to type away and get something done. And fighting that, men and women both fight that. And in this background, women are expected to do everything else at home
Yes,
also.
exactly.
So
As if we
where
have
does
more
she
number of
find the
hours.
time?
Precisely.
And even at work, wouldn't you agree that we have to work twice as hard to prove that you're half as good? But luckily, I mean, it's not that difficult, so you
that
end up
that
doing it
that
anyway.
line needs to be framed. I think that was a
Yeah.
really, really good thing that you said, and it would hold true in every scenario, probably, for anybody that's a minority. Yeah, very well said. I think men don't even have to have this in somewhere in their brains that, I might have to do this, or I might, for as an example, I have a friend who are both, I have a couple. I mean, they are a couple and they're both my friends. So they're both in the same department, both in research, and they had a baby recently. And the woman was expected to just put her career on hold for, 3-4 months, like they said. and take care of the baby full time, which she did as she wanted to. And after that, the transition for her to go back into research was met with so much hesitation on the part of the family. Even colleagues would be like, it's okay, your husband is already here, he can just take care of if you have any additional stuff, you can just tell him. But it was not seen as something that she wanted to do. She was not really free to take that on, because people thought they would know, they could decide for her better than she could for herself. That's also a huge thing. I mean, that happens irrespective of being in healthcare or not. It's just sad it's happening in spite of being in healthcare, where you actually know these biases exist and how they can negatively affect you and your psyche. So yeah, I
So I
mean,
want your thoughts about this, Dipshikha. Like, somewhere I feel, that because, so maternity leave is a great thing. Okay, don't get me wrong. So, 6 months,
don't get
one
me
year,
started
whatever.
on it.
Exactly. So it's great. But I very sincerely believe that paternity leave, which is becoming a thing, needs to be a bigger thing. So I
Absolutely, yeah.
believe that it needs to be like fathers need to be given, okay, new baby, 6 months off, go. So that each parent feels equally responsible for that child, because here, since the mother gets like 6 months to 1 year depending on where you are as a maternity leave, and the father probably gets 1 day leave when he goes to see his wife birthing, it kind of just becomes de facto that, okay, dude, I haven't gotten any time off from work, so this is entirely your creation and your problem.
Mm.
And that's where it all begins, right? You give the guy 6 months off and hope that he feels equally responsible for, I don't know
the
if that's
problem
even
the problem
possible,
yeah,
but
I think if we were to only talk about the good fathers who actually want to spend time at home and take care of their baby and their wife, and likewise the wife also feels the mother, I should say, also feels compelled to do the same for both. If we were to only talk about them, yes, I mean, companies, corporations have historically felt, and even made people feel that this entire maternity leave thing is a waste. Many women are denied jobs based on that. So why would you increase that discomfort for your company by making room for paternity leave? This is, I think, how they approach it. How any person who wouldn't want to let go of their profits, or pay sleeping employees or anything, go about it. So it's very important to note that this disparity is brought on by our places of work. They are creating situations where partners will not be able to equally provide in terms of time or anything else
absolutely.
for their families. So if you are to see it through that lens, it is very, very unfair on men to actually have no time and to have to negotiate for even a week or 2 weeks off. I remember when a couple of my friends were also in their maternity leave. Their husbands had asked for a week off or like 2 weeks off, which you would, as a person in medicine, you would support, because of course fathers need to bond with their babies. Mothers have 9 months to bond, so they already have that thing when the baby comes along. But the fathers actually have to, some amount of kangaroo mother care has to happen from the father as well. So it's difficult. I mean, if that people don't realize that this is an issue, people don't realize they're contributing to that issue, in terms of reinforcing gender stereotypes by not allowing paternity leave. That is something that really should change. Yeah.
Absolutely. Sabha, over to you. I think we'll just keep chatting like this all night through.
You have to constantly keep directing us in the right direction, otherwise this could go on
Yeah.
for hours.
Absolutely. I
So
think it's a topic close to both our hearts.
yeah. Wait. Before we go to the next question, I just had some follow-up questions about research and how women are, disadvantaged by it. So I read somewhere about how, crash test dummies that are used in car safety um procedures are essentially designed to be male dummies,
Yeah.
and that's one of the reasons why a lot of safety features in cars are not designed for women. Women face so much trauma in car accidents, much more than men, because the safety testing is done with male uh, anatomy, right? So in that sense, I've heard of, like, even especially the COVID vaccine, right? A lot of women seem to have so many adverse effects of the vaccine, and I'm told that the vaccine was not properly tested out in women. So, could you tell us a little bit about why, when they are conducting, like, say, pharmaceutical tests or research practices, how do they incorporate women? How does that system work? Like, why are we being neglected everywhere?
Okay. I'll go first again. I'm sorry. So yeah, I traditionally when from many years ago when research started and we started testing on humans, men were taken to be the ideal test subjects because they don't menstruate, they don't get pregnant, and there is supposedly less changes, less compared to women, less changes in men. So initially, everything that we had was only tested on men. Okay, so the side effects that we have lists of are side effects in men. Similarly, now when we started testing in women, then we had some different side effects because obviously our anatomies are not Xerox copies of each other. So it's very important to acknowledge that we were wrong. Medical science has deeply rooted misogyny. So treating, I mean, even uh, as recently as the COVID vaccine, women were actually excluded out of a safety issue. We did not know how the vaccine would, pan out in pregnant females. We did not know how it would pan out in, say, the menopausal women. I mean, we did not have enough data. Even for even the women who received the vaccines during the trials, I don't think they recorded that as much as they should have, because we did not, when the vaccines actually were available for the public, we did not have any data about how it would affect the menstrual cycles of women, which it did affect. I Nothing happened to me, but many women actually faced some. There was a lag, or there was some changes which took a few months to reset. All right. And some people, I think, with long COVID, who actually went on to develop long COVID, not talking about the vaccine anymore, who went on to, like I said, they had long-term symptoms, and many of which we still don't have explanations for yet. So yes, very important issue. Not enough, not many promising things that can be said right now, because it is something that we are dealing with now. So yeah, and even like you said, the car safety, the seat belts are actually designed for the male anatomy, they're not designed for female anatomy. So yeah, discomfort, and ultimately when something bad does happen in terms of a car crash, very different, very significant injuries. Women with their I mean, I wouldn't say traditional, but comparatively smaller bodies, they do get hurt way more. Cervical injuries are more. And yeah, so that's my take on it, Dr. Devayani.
Yeah, so interesting fact is it's only in the 1990s, which is really not that far back, where the research rules actually said that women need to have equal representation in trials if the results of the trials are to be applicable to the entire population. And it took us till 1990 to realize that is something that I can't wrap my head around. But anyway, that's the rule now. So I don't think you can ethically have a trial that excludes women. And all trials are designed to include, not based on gender at all. So it's not men, women, it's all genders. And hopefully late, but on the right track.
Yeah. So we heard quite a bit about how you are facing casual sexism in the hospitals. Um, is there is there like a particular instance that comes to mind where you can you have a lesson for like the patient or someone visiting the hospital, that some things that they can keep in mind where they are not, so that they can be more mindful of how they approach women in healthcare, even the nurses, even the male nurses. Any advice on how should people naturally behave in the hospital in a way that's gender neutral?
So I think more than advice, I think it's going to be a wish list from both me and Dipshikha on this one. So I'm going to narrate, I mean, a tiny story that happened to me when I was training at the Tata Memorial as a resident. And I was in urology, and there was this patient who was due to undergo a prostate surgery the next day. And I'm in charge of prepping the patient, explaining the surgery, the risks, the complications to him, the family, everything. So I go there, spend my time, take an hour, go through every detail of the consent form, everything that we're going to do, what can go wrong, what can't go wrong. And at the end of this, and trust me, this is at the end of a busy day. Like, I'm ravenously hungry. I have 1,000 other tasks to get to. But then you do realize that this is one big event in this patient's life. So he deserves this time. And you're sitting there patiently going through all of it. And the patient gets a phone call. And I'm sitting there and he says, "Excuse me," very polite, takes the call. And I'm thinking, at least nice of him. At least he said, "Excuse me." I mean, somebody else would just go ahead and answer the call. And somebody at the other end asks him, "Ki kya hua? Ho gaya sab? Bharti varti ho gaye? Mile doctor saab se?" I mean, I could hear the other person because it was really loud. And this guy goes like, "नहीं अभी डॉक्टर साहब तो नहीं आए हैं, एक सिस्टर आई है यहाँ पे, इन्होंने सारा एडमिशन वाला काम कर लिया है, सिग्नेचर वगैरह ले लिए हैं और ऑपरेशन समझा दिया है, लेकिन अभी डॉक्टर नहीं आए हैं." And I was like, I didn't say anything, waited for him to hang up. And at the end of it, I'm like, अंकल आपको क्या लगा? Like, सर मैं 1 घंटे से आपको पूरा प्रोसीजर समझा रही हूँ, आप समझे नहीं अब तक कौन हूँ मैं? And then he was very, very sheepish at the end of it. And he's like, "I'm really sorry, but so he actually said that where I come from, women aren't in this field at all. So my mind was just not programmed to think that you could be a doctor. And I am extremely sorry that this has happened." So, which actually made me feel a little bad, because I was, like kind of unleashing all my indignance and anger at this guy. And that's just how he's been brought up. He's not seen enough of it. So for us, I think the lesson is, let's not judge the people who do this, because we don't know where they are coming from or what's normal for them. And from the other side, I think, not advice, but one thing that I can say, like I said, the gender stereotypes are kind of going out now. You have as many male nurses as you have female doctors. So I think that mindset has to change. So the first time you see somebody who's a healthcare professional, I don't think that thought should enter your head at all as to where this might go. And I think it is also very important for the person who meets you to introduce themselves at the beginning of any interaction, so that we can avoid all such embarrassing situations.
I was actually going to say
Yeah,
the same thing. I think introductions are very, very important because you are taking yourself to a patient's surroundings. So introduce
absolutely.
yourself. I think that in the healthcare industry, you have to do that as a rule. We usually don't, because
We don't.
specifically in India, everything is so busy. I mean, if you compare it with the developed countries, they don't have as many patients, and they have much more, staff to patient ratio, much better staff to patient ratio. So yes, we do have to introduce ourselves. We have to. The onus lies on us, as it does on everybody else, to try and end this. The same thing when something like this is happening. I remember I was in the neuro ICU. I was on call yesterday. So I remember I had a patient who was confused because of his head injury, and the relative who was there with him could not fathom that women can be doctors. Like you said, they come from a very rural area, and they were like, "Mere muh se nikal hi nahi raha hai doctor aapke liye." This is, I mean, it's a mental blocks of sorts that they have. So it's very important to correct people, but of course there is a dilemma that you have when somebody is very emotionally distraught, because obviously hospitals are not happy places unless you're going home. So it's difficult to know how to correct, when to correct, when people are not really getting it. So I think there will be some amount of friction there, unintended maybe. So I mean, we will have to take ownership of some of it, and try to stand up for ourselves and define the role that we are in. Other than this, I guess people who there are a few people who readily accept that they were wrong, and they are very, very mindful of at least asking what the other person, even if the other person has somehow missed to inform because of the plenty of things that you have to do in an hospital. Some people actually ask, excuse me, who are you? And it's I think it's something that should happen both ways, where we can have introductions and avoid, like you said, avoid this thing altogether. So yeah.
And as a follow-up to the story, so that old gentleman actually did well, went home, and he actually
Nice.
funds one girl from his village to pursue further education every year. So
This
that
is
was
what we
That's
need.
as a
lovely.
follow-up to what happened.
That's lovely. Speaking of funding, um, can you tell us a little bit about how the healthcare industry is structured financially? Are there, hiring biases? Is there a pay gap that you've noticed? And, is there like a gap in how research funding is allocated within hospitals? Any of that?
So I'll go with
Yeah.
that,
Yep.
actually. So I- uh, maybe Dipshikha can speak for the private sector. For the government sector, thankfully, the way it's built, there is no pay gap because it's at a particular grade or stage, and that's how much you take home, gender irrelevant. Also, I would like to believe that pay gap is more of a thing in the Western world than it is in India. I'm not sure. Please correct me if I'm wrong there. And as far as but the differences would be in terms of hiring, because I feel that there is so much of a golf club backslapping group amongst the male doctors, like catch up for a beer, slap your back, what's up, what's happening in life. And somehow, try as you might, you're always, because there aren't enough of you, you're always that kid in the playground who's a little bit shy, a little bit out of the whole happening scene. So you have to really push yourself in, which makes you look pushy. And if you don't do it, you are never going to be included anyway. So I think it's that discomfort which plays a role in terms of women not getting hired enough. But I think once they get hired, the pay is pretty much work equivalent, is what I'd like to believe. Dipshika, what's your experience in this one?
Yeah, most of the times this is what is happening. Going by corporate hospitals, mine is actually pretty big. And it's pretty standardized. We don't really see it as much over here. But yes, the hiring bit is an issue. If you were to be given a bunch of resumes, you would it's a marked difference as to how many number of men got hired and how many number of women got hired, even within non-physician roles, in our corporations running HR or accounts. Very I have not seen any woman in accounts in my hospital. I've been here for 7 years, but I've not seen any.
Wow, really?
So
That's
and my mom
interesting.
is an accountant, so accountant, yes. Female representation in accounts, yes, but none in my hospital. HR maybe, marketing maybe, but not as much. Even if I were to, if I see healthcare as a sector which includes more than doctors, um, it's a problem. It is a problem, yes. Because and also the pay gaps. I heard stories when I was doing my rural posting. I had a posting outside of Calcutta when I was studying. I remember the women telling me that it's so difficult to get a raise in the private nursing homes that they have around in those areas, because the men are usually seen as people who need to support families. So as soon as a man has a child to support, whether or not the woman is working, they would just get a raise, or they would be able to at least negotiate a raise,
Mhm.
grounds for negotiation. Whereas women after childbirth, the same reason, having a child, the same reason, for a man, it would be seen as, oh my God, he's now more responsible, more so, we should support this person. For women, she's not going to be as attentive. She will have to, be at home more. So what's the point in giving her a raise? Maybe, switch her off to a different role. Maybe try to shunt her off somewhere. This is very prevalent over there. Not so much in my hospital, but yes, I have seen this happen quite a bit. So that's where I guess the pay gap happens. Negotiating your salaries, or negotiating a raise. That's when the pay gap is actually perpetrating.
So we have a
Yeah.
question on the chat actually, which is pretty interesting, to both of us. Other than giving maternity leave, how can workplaces participate in systematically dismantling gender bias? Your thoughts?
Okay. Um, Other than giving maternity leave, I think maternity leave is a basic human right now, as should paternity leave be. So I wouldn't say other than that. I mean, there could be a lot of things that companies could be working on. We need sensitization classes. We need, posh seminars. We need people to understand what you can and cannot say to your female colleagues, because a lot of these there are a lot of deeply misogynistic jokes that happen, and then women are just expected to don't care about, don't be so serious, smile a little, and just taking the focus away from what they do is going to ultimately affect their confidence in what they do, in doing the good things that they do professionally. So this is one thing that maybe companies can focus on, bias sensitization and stuff like that, to constantly have a dialogue, and also to have functional complaint cells where women can go and raise issues and not be, they should not be swept under the carpet. So people who are actually reporting issues of harassment, bullying, or sexism or anything like that, they should feel empowered to do so, and that should be dealt with swiftly, which is very, very rare. I think it's probably, I've seen that quite a bit. I actually have an incident to talk about myself. So it's very, very sad that you would expect, because in India at least, or maybe also the world over, we equate educational qualification, professional success and fame and money with being a good person. You will not be a good person even if you're rich or very successful or anything. If you're not a good person, that all those things will not matter unless you're being nice to the person next to you or opposite you or whatever. So this is important, to treat people like people and to not discriminate when somebody is actually coming up with a complaint based on this. What do you think, Dr. Devayani?
Yeah, I completely agree with all the points that you raised. And I also think that as companies, there should be a lot more now, hopefully COVID's behind us. So bringing people together, like, inclusivity should be a thing, like get everyone together, whether it's your annual get-togethers, night outs, whatever. But, it shouldn't be like men versus women as two separate groups, but try and see more of each other, interact more with each other so that the trials and tribulations of each gender. I'm sure men have their own take on how this whole thing pans out in terms of bias. So be more vocal about it and be more inclusive. And by that, I don't mean that we should have, like, just add a few women to the entire milieu and stir. That's not going to work, because it's not just about adding more women. It's about making them feel included in the entire scene. So whatever can be done to make them feel a part of what's going on, I think is equally important on a more informal level.
Yeah.
We have another question in the chat about what are your thoughts on granting period leave every month? And is that something that should be acknowledged?
I support it. I 100% support it, because for some women, period cramps can be extremely debilitating, and you cannot be expected, say you have a cut on your arm and it hurts. You cannot be expected to work as if nothing has happened. Same thing should, I mean, periods have always been seen as something that is bad, or you're conditioned to hide it. You're conditioned to go to the hospital. You somehow have to stuff the pad inside your pocket and then go to the bathroom when you're in school or something like that. And that really carries on even in the workplace. Nobody wants to talk about, once you wave a pad in somebody's face, nobody wants to talk to you anymore. They'll just go quietly back to doing whatever they were doing. So this stigma has to go. Period leave should be implemented for those who need it 100%. Dr. Devayani.
Yeah, so different strokes for different folks. All of us have different periods at different times of the month. So some days might be really bad, but sometimes you might just breeze through. I think a woman should have the choice to be able to exercise the choice of taking leave and stating clearly what that leave is for, without facing any kind of judgment and without feeling shy about it. Like, I should be able to, even in healthcare, we're not able to do it. But I think we have reached there when we're able to go and tell our boss that, listen, I'm on my period and it's a particularly bad day today. And I think I'm going to take off. And if that can be done without judgment on either side, I think that's the day we've arrived, so to say.
Yeah. I'm yet to get there, to be honest. I don't think, I mean, I have actually made a different excuse, and said that, okay, I'm not, I just don't feel well today. But I haven't been, I haven't really said that I don't feel well because I'm on my period. I will change that going forward.
I'm going to do that
And
too. I mean, I
let's
haven't
see.
thought about this.
Let's
Yeah,
see.
let's see if
Yeah.
how
Let's
it
see.
works.
Yeah.
Definitely.
I don't even want to think of what reaction's going to be like, but I think that's how the dialogue gets going, right? That's how it
Yeah.
becomes like
Yeah.
a done thing.
Somebody has to begin.
Somebody has
It
to
has to
start.
begin somewhere.
Definitely. So wrapping this up with just like one last question about, um, I see that, when you speak of the various ways the industry has changed, it's definitely, even with the pay gap you mentioned, there's not as much that you have seen. So I've grown up with doctor parents, both my mom and dad are doctors, and they used to always apply to jobs as a couple. And my dad actually just has an MBBS while my mom has a master's. But and because this was in various small towns and university hospitals, they would try to use the little age gap that they have to actually give my dad a higher pay package, because that's how it was for them. So there, I see that there has been a lot of change. I just want to understand if the medical curriculum has incorporated some of these bias training systems. Does it include in ethics, or like, is there more sensitization happening at the learning level?
I don't think so. I mean, we would have heard
No.
about it if it were happening back when I was training, and maybe also Dr. Devayani. I don't think there was
Nothing.
anything like
And
that.
honestly, I think this needs to come up in school
Yeah.
rather than as late as medical
Yep. Yep.
profession, right?
Mm.
Definitely.
And it
But
should continue throughout. I mean, there
Absolutely.
is,
yeah,
it does not end anywhere. You never stop learning. If you have
yeah.
these, if you have your intrinsic biases, you don't just, wake up one morning without them. You will need to be continuously, trained in recognizing the problem and fixing it, probably.
So, somehow
And
I think this entire he for she feminism brigade that we are on, it's a great thing because it gets people talking about it. But I also feel that somewhere we have to find the balance because it's kind of ricocheting back at us. And I'd like your take on this too, Dipshikha. Like, do you face situations where, say you're invited on a panel or a group because you're a woman and they don't want it to be a manel
Yeah.
and they want to
Yeah.
include a woman in it, and you face a lot of
Just for the
judgment
sake of
because
it. Yeah.
exactly, and you're like you face judgment going like, oh, she's here because it's a her,
Yeah,
and
because it's a free pass. I mean, anybody could have been there in her place. I mean, she did not really
which kind
have
of
to do
takes
much.
away
Yeah.
exact to get there, which kind of
Yeah.
takes away from how good you actually are. So even that is a double-edged sword. So we
Mm.
shouldn't go down the path of reservation and being like it can't be a man, there has to be a woman. But at the
Mm.
same time, I think we need to be more vocal about women who are really good at what they do so that they get recognized for it rather than just for the fact of being a woman, is the way I look at it. Because I think we
Mm.
are treading on dangerous path the way we are going right now with this entire thing.
Yeah, that's true. That's
definitely.
true. Completely agree. Completely agree.
Yeah. Also, following up the sensitization workshops, do you see any of these happening in the hospitals that you work at? Because corporates
Oh,
tend to have a lot of, like, we tend to have a lot of workshop once in a while, speaking about how you might be um, casually sexist in the workplace, and there's, like, a lot of gender sensitive sensitizing workshops. Is there any happening in the hospitals?
not
No,
that I know of.
not really.
I mean, and I
Mm,
should know about it if it were happening. I
yeah,
have
yeah.
not, in my entire 7 years of being with this organization, I have not seen even one. I have not seen mention of, even trying to organize one,
Which
which
is very interesting,
speaks
actually.
volumes.
Dipshika, something to think about probably and suggest
Mm.
and get
Yeah.
done at
Yeah.
our workplace. Thanks,
Yeah.
Ava. That's food for thought.
Yeah. Any closing comments, guys? We're almost at the end of the session.
I think we would have a lot of closing comments. it's Just a never-ending topic. I really enjoyed talking about this. I mean, I try to talk about it as much as I can. Like you said, Devyani, that you're not so what should I say? Without how should I say it politely? You don't get your head into it too much. But it's something that I never usually give up. If somebody is talking about something that is even borderline sexist, I will jump in, and people will be like, "Oh my God, we can't talk next to her." So I'll be like, "Yes, don't talk next to her. Don't talk next to any woman while they're like that." Or it's very important to stop them when you see, as soon as you see it.
Absolutely.
So whether it is in healthcare, whether it is anywhere else, it's very, very important for people to realize that this is not the way to talk to somebody. And you can guise it under the garb of a joke or something, but it does not take away from the detrimental effect that it has on people. So you have to be extremely mindful. We have, I think, been conditioned to accept anything in the name of a joke, and that shouldn't be it anymore. And this is not a joke, this is real life for people. So it's important to address this issue, and it's important to take ownership of what you're talking about. And it's important to acknowledge that somebody might call you out on some of your intrinsic biases, and rectify yourself. So yeah, taking
Truly.
every opportunity to fight.
That's true. And
Lovely.
I think
Yeah.
it's important for each one of us as a woman to own ourselves completely and have conviction in whatever it is that we may believe or think or what we are going through. And till we feel that way about ourselves, convincing somebody else would be second. But I think we've grown up with biases too. And it's time that we take ownership of what we believe in or what we are.
Yeah,
And it'll change.
Yeah.
And I had a great time. Thank you so much for having me
I
on.